Okay guys, so I want to talk to you just a second about what really drives your care in labor and delivery. The only reason usually that someone is on labor and delivery unit is because they are pregnant. So one of the top priorities there for everyone is your baby and you, right? Because you are the vessel that is growing this life in this little person. And so the baby is typically only going to be as good as you. That's why you'll see like some women who have gestational diabetes or hypertension in pregnancy or preeclampsia or anything else, they usually have to be monitored more closely and quite often are scheduled to be induced around 37 weeks, which is technically full term. But it's because while you are carrying your little one, everything impacts the baby, literally everything. Whether or not you eat or drink today impacts the baby, right? If you take a medication that makes you sleepy, it'll probably make your baby sleepy as well. So anyway, all that to say, electronic fetal monitoring is a top priority for when you come to labor and delivery, because the only reason you're there is because you're pregnant. And so because of that, we are going to right away hook the baby up to a monitor and make sure that the baby is doing a-okay. That having been said, I will tell you that the research has shown that just because we are doing continuous fetal monitoring, it does not necessarily mean that we are having better outcomes. It's unfortunate, but true. And there's a lot of reasons for that I won't get into right now. But what I want to let you know is that no one can promise you anything when it comes to your delivery and your labor experience, right? Because it all depends on how your baby looks. And that's just the truth of the matter. Now, electronic fetal monitoring is a whole beast and bear in of itself. And most people aren't really good at it, including a lot of doctors and nurses, right? It's the point of a lot of litigation because you have to read this essentially foreign language, interpret it correctly, and then intervene or not based on what you're interpreting, which means you have to be pretty fluent, right? It's not easy. It's not easy. I used to be an electronic fetal monitor instructor via A1. They are not endorsing me, and I'm not sponsored. I'm just letting you know. So fetal monitoring is tough. So if anyone is guaranteeing you a specific outcome without even knowing how your baby's doing or knowing anything about you, about your health or the health of your baby, or seeing the fetal heart rate, then they're lying to you. They're trying to get you, boo. They're trying to get you, and don't let them do it, okay? Tell them that Nurse Renee said you can't possibly know that. But it's true, and I want you guys to understand that. And understand that a lot of decisions that are made while you're in labor are based on you and your stability and the fetal heart rate tracing. So you may want to sit on the labor ball and do all of the things, but your baby may not be tolerating that position.